Patients who are eligible for weight loss surgery have to have a body mass index of 35 and over if they have an obesity-related illness, or a BMI over 40 without an obesity-related illness. You choose between the different operations, band, bypass or sleeve, by reading up about them and discussing them with your surgeon, as each operation has different advantages. Weight loss with a gastric bypass typically tends to be faster than what we see with gastric banding. Gastric bypass patients will often lose a lot of their excess weight within the first 6 months after surgery. Gastric banding patients, however, rely on adjustments and therefore will have a slower rate of weight loss which will be maintained throughout the year after surgery. Whether one operation is better than the other is very difficult to answer. It really very much depends on you as a patient, how comfortable you are with each of these operations. Each of them has different ways of working and different advantages. The operations vary in their length. A gastric band typically takes about half an hour. A sleeve gastrectomy takes about an hour. And a gastric bypass typically takes an hour and 10 minutes. The hospital stay really depends on which operation you choose. These days, gastric banding is done as a day case operation, so you can come in, have the operation and go home the same day. With sleeve gastrectomy and gastric bypass, you would typically stay in hospital 2 or 3 days. Nowadays, because all these operations are done with keyhole surgery, it's much less painful than what it used to be in the old days when we used to do them with the open, large incisions. The scars are very small indeed, measuring between half a centimeter to a centimeter, and they usually heal up very nicely and are invisible a year after surgery. It is important to do a pre-surgery diet for around 2 weeks before the surgery in order to shrink the size of your liver. The liver sits immediately above the stomach, and in order to do the operation we need the easiest access to the stomach. By reducing the size of your liver, it makes your operation easier for the surgeon. Type 2 diabetes can be cured with weight loss surgery. Certainly with the gastric bypass, we find that the diabetes improves very rapidly after surgery. Equally with gastric banding, diabetes can be resolved in most cases. Most people can get back to work usually a week or 2 after the operation. It is important to take vitamins after your surgery, as you will not be eating the same volumes of food that you were eating before surgery. So it's important to make sure that you take your regular multivitamins to make sure you do not become deficient in any micronutrients in the future. Once you've lost weight with the surgery, it is rare for you to require any further plastic surgery. However, we know that in about 5 to 7% of people who have lots of excess skin, who've lost a lot of weight, the excess skin can cause irritation, and it may be important to have this removed through a plastic surgeon. A few people will experience some hair loss, but this can be minimized by making sure you take enough protein and multivitamins after the surgery. Dumping syndrome is a phenomenon we sometimes see in patients who have undergone gastric bypass, where whenever they eat food that's rich in sugar or carbohydrates, they feel rather unwell afterwards, sometimes complaining of pain or sweating. This is not something dangerous, and in fact, it's a good deterrent to prevent people from eating foods that are rich in sugar like desserts and sweets. You can have alcohol after your surgery, but you must take it in moderation. We know that following the gastric bypass, patients tend to become more sensitive to the effects of alcohol, so it's important to reduce the intake of alcohol. Also, one must not forget that alcohol is rich in calories. For example, a glass of wine has about 150 calories, and you really want to limit your caloric intake after these operations. It is important to avoid fizzy drinks after the surgery because in one form or another we have reduced the size of your stomach. If you drink a fizzy drink, it'll make you feel uncomfortable, but it is not dangerous. Once you've recovered from surgery, you can go back to taking your regular medications, but of course some of the medications may need to be altered in their dosages because we have improved your health. It is important to have a good support group after the surgery so you can keep in touch with other patients who've been through what you're going through, and you can ask them questions about life after weight loss surgery.